We at MD Coaches know that match is a stressful time. If your match results were not what you expected, you might need the time and the space to explore what's next. MD Coaches is proud to offer a comprehensive 6-week virtual group coaching program that explores your unique value and possibilities beyond the match. We're offering 4 separate rolling cohorts, Sundays, April 7 through May 12, or May 19 through June 23rd. A second option is Thursdays, May 2nd through June 6th, or June 13th through July 25th. All sessions begin at 7 p.m. Eastern Time. You can register today at mdcoaches.store/medical-student-coaching.
When you leave it like that, then you realize, well, I'm just going to be banging my head against the wall trying to get the crap done that I know the patient needs, just fighting the fight, the peer-to-peers and all the LCD changes and working harder to get paid less and all of that headache. And I just got more and more frustrated.
Paging Dr. Cook. Paging Dr. Cook. Dr. Cook, you're wanted in the OR. Dr. Cook, you're wanted in the OR.
Welcome to the Prescription for Success podcast with your host, Dr. Randy Cook.
Hello, everyone, and welcome to Prescription for Success. I'm Dr. Randy Cook, your host for the podcast, which is a production of MD Coaches, providing leadership and executive coaching for physicians by physicians to overcome burnout, transition your career, develop as a leader, or whatever your goal might be. Visit MD Coaches on the web at mymdcoaches.com because you're not in this alone. And don't forget that CME credit is available when you listen with us. Just look for CMify in the show notes to learn how. My guest today is the founder of Direct Wound Care and Consulting, one of a very few direct pay wound care centers in the U.S. She is board certified in Undersea and Hyperbaric Medicine, and she has practiced wound care since 2006. So, let's hear my conversation with Dr. Tay Sha Howell. What a pleasure it is today to be having a conversation with Dr. Tay Sha Howell, who is coming to us from somewhere in Texas. And, I don't have that in my notes. So, Dr. Howell, where exactly are you today?
I'm actually just north of Texas in Oklahoma. I'm in Edmond, Oklahoma.
Now, how did I get that wrong? I'm not a very good researcher, I guess. Well, all right, Edmond, Oklahoma it is. Well, welcome to the show. It really is a pleasure to have you here, Tay Sha. And because of my history in wound care, I'm really fascinated with what you're doing. So I'm looking forward to the conversation. Let's get underway, as we always do, by finding out something about your beginnings. Are you an Oklahoma native, or are you transplanted into where you are now?
Yes, I was born here and been here the whole time.
That's pretty unusual.
Yeah.
Yeah. Most of the folks that I talk to have bounced around a lot. So clearly you're happy there. And I'm always interested in the circumstances and situations that led you into a life in medicine. And I'm wondering, are there medical types in the family? Is this something that you came up with all by yourself? What's the story behind that?
I actually went to college to get a degree in art and was on an academic scholarship paying for college myself, and found I didn't enjoy the subjective grading of art when I had to maintain a certain grade point. And at the same time went to a health fair that I thought was kind of interesting, and was also doing well in my biology class that a bunch of pre-med and pre-vet students were doing poorly in. And so kind of the combination of those three things made me kind of take a look at my major and switched to pre-med.
So up until that point in your life, a career in medicine had never, ever entered your head.
No, my stepdad was a radiologist and my aunt and uncle were pharmacists, but
So you had some connections.
yes, but nobody really encouraged or fostered that.
Well, I'm really fascinated with this. So, and particularly coming from an aspiring artist, is there? Do you have any idea what pointed you in that direction? What do you think the appeal was at that point?
Well, I thought some of the things that I was learning in biology class were interesting, and then asking some questions at that health fair and deciding, well, I could certainly do this as a career. It's promising, and I can always do my art on the side. But of course, nobody really, you don't have any free time.
Yeah. And I'm wondering, at that particular point when you made that really significant decision, how were you picturing yourself as a physician? Did you even have any notion about what specialty you might follow it then, or what, again, what exactly was in your head?
I originally thought I might like to do pediatrics, not really for any set reason. I just sort of thought that would be up my alley. But once I did some of the rotations, I liked the kids, but I didn't particularly like some of that interaction with difficult parents.
Yeah.
So then I was kind of back to square one, like, I don't know what I want to do. And then I didn't think, ironically, I didn't think I wanted continuity of care, and started really looking at emergency medicine, which is what I ultimately went into and did a residency in. So,
did you find medical school overall, I don't know if enjoyable, I don't know if anybody would ever call medical school enjoyable, but was it in any way inspiring, or did it really have significantly more appeal to you than a life in art?
I think by that time I was so far away from the art part. I liked the creativity of art, but I think trying to make a living in that's hard. You either get diluted away from the creative part, and you're doing more like advertising or graphic design for somebody else, or you're really going out on a limb, and not very many people can support themselves with that.
Yeah,
so
there is a reason for the origin of the term starving artist, I guess.
Yeah. So I do think innately I like the security of, like, I'm going to have a job. There's not going to be a lot of insecurity about, where I'm working or what I'm doing. So I thought med school was challenging. I think undergrad was really pretty easy. And although at the time it was stressful, but to be with a whole room full of people that also found undergrad easy, and kind of find your place in that new bell curve.
And ultimately, emergency medicine became your choice. And I'm interested, once you got into your residency and that's what you were doing day in and day out, did it feel like a pretty good fit at that time?
It did. I loved it. I loved the not knowing what you were going to do every day. I loved the camaraderie of the team, in the ER. And I loved combining the procedures with the medical care. I think that's what I, liked the most.
Yeah. There's a lot of immediate gratification in emergency care, don't you think?
Yes and no. Having stepped away from that now, I really... You literally save someone's life, but it's kind of a thankless job in some ways. Like, no one thinks to show their appreciation,
I know,
or they don't realize how close somebody was to dying, or what have you. Or, it's such a high stress, kind of not great environment for the family or whatever. They're mad because they had to wait so long, or they're mad because there's no coffee, or they're mad because the nurse did whatever. And by the same token, the upstairs doctors, the admitting doctors, well, they don't want to be woken up in the middle of the night. They don't want another admission. They, there's some of that where, why didn't you catch blah, blah, blah? It's kind of a fishbowl where you're just, it was hard to say that when somebody said, well, what kind of medicine or what kind of doctor are you? When I had transitioned from ER to wound care, well, nobody even knows what wound care is. I think you're saying womb, like, uterus. And it was, people, whether from the, TV show or what have you, they think being an ER doc's kind of glamorous or whatever. But it was something people understood. And to get away from that, that was really, it took a while for me to be comfortable saying, well, I used to do ER, which isn't really relevant to the question.
It sounds like you took a little bit of abuse, if I'm correct, if I'm selecting the right term, from the people who had to be called because this was not something that could be treated and treated. Was that really common? Because I'm going to have to tell you, as a surgeon, I tried to stay on good terms with the people in the ER. Were they hard on you?
I wouldn't say common. No. I mean, there were definitely our favorites that we would, it's Dr. So-and-so. Thank goodness, you're going to call. I mean, I think that goes, there's pluses and minuses to any field. It's just in hindsight, I find it much more gratifying to grow a millimeter or centimeter of skin than deal with all that I used to. So it wasn't abuse. It just is something that most people don't realize, that the ER doctor has to make a decision with the minimal amount of information and then get whatever team or other things needed for the patient. So
yeah, a lot of stress, and at the same time, not really a great deal of follow-up gratification, I'm guessing.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics. Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview. Where in the career trajectory were you when you began to consider doing wound care or something in addition to emergency medicine? When did that transition take place?
I had finished residency, done my boards, and was practicing at a big, busy metropolitan ER for about just under 10 years. And my husband's a surgeon. We had 2 kids. We had a nanny that helped us, and everything was fine. I liked my job. I liked my hospital. Never thought about doing anything else. But when my kids started to have a schedule, then I was missing after school, dinner, homework, bedtime more than I was comfortable with. When they didn't go to school or have a schedule, then I could sleep, get up, spend time with them. I wasn't missing as much. And I just remember telling my husband, I don't think I can do this anymore. And he was like, work in the ER? And I'm like, well, I guess work in the ER. I mean, I don't want to quit work, but I can't miss all this.
So there were lifestyle considerations.
Right. And at the same time, for probably a year or two, one of the other emergency medicine doctors that I had worked for briefly at a different facility, she had already made a transition from emergency medicine to wound care. And she was periodically calling me saying, I think you'd like this. I think you'd be good at it. It's better hours. And I was like, yeah, no, thanks. I'm good. But then when I wanted to wear my mommy hat more and I wasn't good anymore, I'm like, well, I guess I'll call her and see what that's like. So I shadowed her a couple of days and talked to her about it. And I finally, you can use your medicine, you can use your procedures. The hours are great. I thought I would be bored, but I could do it. And it was ultimately going to make me happier because it was the right thing for my family. So it's one of those funny, life takes you where you're supposed to go, because this is my passion and my place that I was, meant to be. So I left the busy ER and I worked in a small emergency medicine, emergency department, urgent care, and wound care 1 day a week. So I kind of cobbled together several different things. Then I took another wound care day and started liking it more, and then had the opportunity to do the medical director position in a different hospital. So I took that, and that clinic was part-time. They were just, I think, 4 half days a week when I started. And so we immediately went to 5 days full-time, got hyperbaric chambers, added a doc, add another doc, built a new clinic, added more docs. So just grew and grew and grew. So I was always a worker bee, in the ER, and that was fine. I never intended to be a leader, but I really thoroughly enjoyed that chapter until I didn't, And then,
so safe to say that boredom was never a problem.
No.
Let's talk about that next transition. And I'm really fascinated to hear about this transformation. I did a little over 10 years of wound care and HBO myself, and it was strictly under the old style. And what you're doing right now really seems like a dream. So why don't you start by telling us what direct care wound management and hyperbaric medicine looks like from your perspective?
Okay, so I'd like to back up a little bit and talk about how I decided to make the switch, or how I did make the switch.
I'd love to hear that.
So big, busy clinic, lots of different programs, inpatient, diabetic limb salvage, about to turn 50 and think, okay, what's next? My hospital was a community hospital, so not one of the national or regional organizations that we could really scale some of our projects or programs. it became clear that while not bored, it was definitely, I was hitting a plateau. I realized that I was only going to be doing patient care and doing the management and not really developing, expanding. And it was dawning on me how much I liked that part. And when you leave it like that, then you realize, well, I'm just going to be banging my head against the wall trying to get the crap done that I know the patient needs, and, just fighting the fight, the peer-to-peers and
struggling to get paid.
LCD changes and working harder to get paid less and all of that headache. And I just got more and more frustrated. I mean, I had a great team and a great clinic and I loved my patient care, but as on probably almost every practicing physician out there, your time with the patient just gets whittled down and the rest of it's typing in the computer or, fighting for something. I just could not envision doing that for another 10 years or 15 years, whatever's left. So I started trying to explore other options, think about things. And one of my friends said, you ought to talk to Jay Kempton. So he's an acquaintance, at that time acquaintance, our kids had gone to the same school, and he's involved in the Free Market Medical Association. My friend just knew that he was part of doing things a different way, without insurance or what have you. So we had coffee, and his group is a Kempton Group. It's a third-party administrator. Their clients are employer groups that are trying to be self-insured. So he's trying to find them the best care that's less expensive. And then if it can't be found that way, then using traditional, like Blue Cross or whatever. But we had a 2-hour coffee, and he gave me some suggestions. He did some email introductions to 4 different physicians. One was an anesthesiologist who's a part owner of Surgery Center of Oklahoma, and they are kind of the premier surgical center doing free market stuff, like setting the standards for that. And one was an emergency medicine physician that is part of the group that owns Oklahoma ER, and so they're doing some direct care. One was the head of Primary Health Partners, that's a direct primary care here in the Oklahoma area. And then another was a lipidemiologist who has been doing direct specialty care for like 25 years. I mean, she's way ahead of the curve. So I met with each of them. And so none of them are doing wound care, but just learning a little bit more about how it might work and asking questions and brainstorming. And everybody's very encouraging and everybody's very inclusive, trying to, help each other out. And one thing that Jay did tell me was, obviously nobody's doing that here, but look around, find another wound care doctor that's doing direct pay wherever in the country. It'll be worth your while to try to connect with them, fly there, see how they're doing it. Because I just couldn't envision, well, how am I going to charge? You're just so tied into a CPT code and insurance stuff and those kind of numbers. And if I don't see 30 people a day, then how am I going to make any money? And so I looked and looked, and I could not find anyone else in the country. There were a few podiatrists doing some direct pay for a few procedures, but no one doing what I'd been doing, what I wanted to do. And so I finally just was like, well, I'll just have to make it up, which has been what I've been doing. I mean, just making it up as I go. And I had a great billing company when I was doing traditional medicine, wound care. I used her as a business consultant to help me figure out, because I was in a hospital-based clinic, but she helped me figure out, okay, this is the average commercial charge for an office-based code. And this is the average Medicare charge for this office-based, because I was going to be office-based, not hospital. And then just trying to figure out, okay, if I want to make X amount of money, how many days a week, because I also didn't want to work full-time. I wanted to work part-time and do some speaking and consulting and some different things just to kind of catch my breath and explore other avenues. So anyway, she helped guide me a lot in like how to figure out how to even, charge. And she wisely said, I think you ought to lower what you think your new patient price is and raise what you think your per visit charge is, because most of the time when people see you, they like how attentive you are and, how much time you spend with them and your bedside manner and such, that you hardly ever lose a patient once they get in to see you. So I thought that was good advice, because it's kind of a lot. The patients are like, oh, I don't know if I can afford that.
So early on, you're talking about adjusting the fee schedule.
Right. And I've adjusted it mostly going up a little bit, not so much on a tiny bit on my new patient price, but a little more on my, weekly or per visit price. I figured out how to offer some package pricing when that patient's going to be coming for a bit, and that give or take, it's pretty much going to be this price. So I have signed on with one third-party payer, which is the Kimpton Group. We have a 2-page contract and a price list, and I don't get pre-authorization or, it's on the list. So, I mean, that's a win-win for both sides, but mainly for the patient, because if the patient uses me for wound care, then they pay nothing and I get paid, and the Kimpton's clients pay less than they would if the patient went elsewhere. So
sure.
That's been a good referral group for me. I found it interesting where I get patients from all over. I mean, there have been times where half my practice is Medicare with the secondary, and so they could pay zero anywhere, yet they'll come to me and pay out of their pocket because they weren't getting what they needed from wherever they've been, or they've been to multiple places, or their primary care doctor or whoever referred them said, you need to go see Dr. Howell, or word of mouth from family members, friends, whatever. And also, old patients from my previous place will, they knew I was gone from my old center, but they would look me up and come. So,
and so in your current physical location, I gather you're renting space, and are you also renting HBO chambers? Did you purchase HBO chambers? How does that come about?
So unfortunately, right now, I don't have hyperbarics.
So you're not doing HBO right now?
Right.
I got you. Okay.
I boarded in that. So I'm board certified in that. And I missed that. I am leasing space. Because I'm part-time, it's difficult to figure out how I would arrange that.
I understand.
And it would be a big, big business investment up front. I've learned to just never say never, because there have been so many changes and things about this whole thing since I started it, which makes, that makes it kind of exciting. But I have found another center that has where some of my colleagues work that I respect and trust. So I have definitely had when, if a patient finds me from however they find me, and then once they understand I don't take insurance, then I help them get to a clinic that I feel good about recommending, so they don't just end up wherever. Or if the patient is ongoing with me and needs hyperbarics, or is ongoing with me, but then really wants to start using their insurance, it's taking longer than they thought, or something's changed with their financial situation, then I'll refer them. And so I have made some arrangements with a local wound care center that has hyperbarics for some cash-based hyperbarics. So if they're already doing a cash pay plan, they've got some reasonable pricing. I don't lose the patient, and then they can still get hyperbarics just at a different facility. So it's not as ideal and well packaged as like my old center, but get creative enough, you can find a way to work something out.
Well, you are kind of in the process of reinventing the wheel here, and I'm sure that you're aware of that. And I would imagine that the longer you do it, the more likely you are to come up with strategies to make it work better. Do you have any idea how many direct care wound centers are in existence now?
I still don't think there's many. I'm in some private physician groups, like on Facebook, with direct care and direct specialty care. And there's been some, signups. You can see where people are in the country and what specialties and things like that. I would say there's only like a handful. There are some podiatrists that are, do a fair amount of wound care, but again, that's only, limited to their area. There's direct specialty dermatology. There's more and more of those. And some may do a little bit of wound care, but most just do derm. So it's still pretty rare. Yeah.
Well, you really are still in the process of, as I was saying before, reinventing the wheel. And I should think that the longer you do it, the more likely you are to see a sliver of light somewhere that that you might be able to take advantage of. But it's pretty brave of you to even take the chance. And it sounds like, at least for you personally, it really has worked out very well. Or am I misreading that at all?
I think it's been great. I don't regret it. I mean, I loved my time at my old center again until I didn't. It was time to do the next thing. Same with ER. In hindsight, I was like, oh my gosh, this is a kind of a thankless job, like I said. So it's definitely a whole separate chapter professionally and personally, because I have been very intentionally part-time, so that I have a tendency to, like what happened with my old clinic. It was part-time, and then it was full-time, and then it was overtime, and it was the clinic, and then it was inpatient, and then it was a diabetic, like it just grows. And there's only so many hours in a day. And so I have enjoyed being able to take a breath and go to the gym and spend more time with my friends and family and, things like that. So I am very intentional about it being part-time, and I could definitely work harder at marketing and growing and trying this avenue and trying that. And I love where I'm at with it. I mean, I will continue to grow it slowly, but I think making that switch kept me in medicine. I think had I stayed on my path, like I said, because there was nothing else feeding me, passion-wise or whatever, with like, oh, we're going to develop this program or this, like there was nothing really left. We were sort of just at a plateau. And I wasn't really bored, but I think I just would have burned out because all the other headaches were overshadowing any joy that I was still getting out of the patient care. And now it's only patient care. I have a little administrative, busy work that's not my favorite, but it's all time with the patient, and nobody's in between the patient and I telling us what's going to qualify or what's not. I just tell them this dressing costs this, or this graft costs this, or this option costs this. And same as any other field, you don't tell people how to spend their money. You just tell them what their options are and the pros and cons, or what you would medically recommend. And we can do whatever pricing tier works for you. It's kind of fun to be creative that way, helping people on whatever level they want.
I did general and vascular surgery for close to 40 years, I think, before I started doing wound care and hyperbaric oxygen. And my personal experience was that I would never in a million years have guessed that this was going to be something as gratifying as it was. Has the experience been similar for you?
Yes.
Because
100%.
you're kind of you're the only one around who will actually be a friend to the lepers, as it were, right?
Exactly. Right. No one else knows how to make it better. it either looks yucky or it smells, or there's that perception, whether it's true or not. And they need such, typically weekly visits, so you get to be like family.
Yeah, the sense of gratification for me was way beyond anything that I had expected, and I am just delighted to hear that you're having the same experience with it, and even more delighted to hear that you're able to do it in a way that separates you from the unbearable agony of having to deal with insurance companies and other third-party payers that kind of really take all the joy out of practicing medicine, I think. I'm very happy to hear your story, and I appreciate you sharing your story with us. Before we go, it's time for us to do what I like to do the most, and that is give you an opportunity to speak for yourself. So I'm going to get out of your way for just a few minutes, and audience, Dr. Tay Sha Howell is going to share her personal prescriptions for success.
Thanks, Randy. So my prescription for success, I would first say that you should really believe that you can be that person that makes a difference. Like one person can make a difference, and to try not to be lulled into thinking that you can't change the status quo. So that might seem like it's too ambitious or too egotistical, but really it's about just using your voice. So an example is that I had was I was on a women's executive board many years back and presenting about a dilemma I was having trying to find diabetic foot ulcer patients better care. The care was fragmented. The amputations were needless. And ideally, it's a team approach, but it's really hard to orchestrate that, and it's rarely done. And someone said, well, you can develop that. And I sat there with my mouth open, kind of shocked. Like, it seemed insurmountable, but it inspired me to kind of lean into, if I'm the most passionate person in the room about the project, then just to use my determination and perseverance and get the administrators of the hospital interested and get the physician buy-in. And so we all, got together and built that diabetic limb salvage program and made a difference in the amputation rates. So, it can be done, and it really does just start with one person, speaking up. Now in my small volume practice, my impact's a little more one-on-one, but I wouldn't underestimate the effect that has for people, like we were just mentioning. And it's the extra time you can spend with the patient, or the extra step to coordinate a team that helps support the patient. So it's not really about having to do it all. You don't have to do all the work. You just really have to start the conversation or sometimes be the unpopular squeaky wheel. But so again, don't think that you can't make the difference. And my second recommendation will relate to career changes. So we've talked about some of the changes that I've made along my career path, from ER to wound care, and then from traditional to direct pay wound care. So I feel like I can offer some insight on making a change on your career path. And I think the main thing is really just trusting yourself and honoring that feeling in your gut, like something's not right here. So now, if I can sense that, if I feel like I'm not lighting up about the mission, or my self just does not align with whatever the organization's doing or whatever's happening with the program or what have you, then I can tell then it's time for a change. I just don't think that we listen to ourselves enough. And so I would encourage people to really listen to their gut about that. I would find myself sort of fantasizing or envisioning what myself when I wasn't doing X anymore, whether that's this type of medical care job or this, executive board or this or that. Like what does that look like? And I would physically feel relief when I pictured me not doing it. And so that's a big cue to yourself that it's time to move on. And so it's not like you're just going to quit impulsively. I would never recommend that. But I was encouraged, and these are some of the things that I did that kind of helped me go from one career path to the next. So just being open to brainstorming, seeing or envisioning yourself in different roles, thinking outside the box, being open to new opportunities. So kind of just deciding, I'm not going to be doing this forever. So what is it that I'm going to be happy with? And it's uncanny how things will just start to come your way. Talk with mentors, talk with other people in fields that you might be interested in, or even visiting with a career coach to help you start planning the next phase. And it doesn't happen overnight. It probably took me 2 years from the time I thought, oh my gosh, I can't keep doing this anymore, till the time I walked away from the big wound care center, but haven't regretted it. So, and then the third one is that I think physicians need business education. Like, I don't think this isn't emphasized enough in training. I wish I had more. Didn't know one thing about starting my own business. And so I really feel like the lack of that leads physicians to feel trapped in whatever situation they're in. Like there's no other options. And, that's just not true, especially for pre-med students going in or med students looking at, when they're coming out, they feel like they can only do an employed model. And that's not necessarily the best choice for each person. So whether it's with undergrad or postgrad, or even on your own with various books that are available, I would just recommend more business education. So that wraps up my prescriptions for success.
Outstanding. In my list of high points, I've got number 1, believe that you can make a difference. Number 2, trust yourself to know when it's time to change and consider a career coach. And number 3, invest in your business IQ. And I think that is really a lot of wisdom right there. And thank you so much for sharing with us. Before we go,
thank you for having me.
You bet. Before we go, I want to give you an opportunity to tell our audience where you can be found if you'd like to share email addresses or Twitter handles or anything that you'd like to share with the audience. Please do.
Yeah. So my email is drhowell at directwoundcare.net. And that's my website, directwoundcare.net.
All righty. Dr. Tay Sha Howell, it's been a lot of fun speaking with you today, and I want to thank you so much for being on Prescriptions for Success.
Thank you, Randy.
Thank you so much for listening with us today. If you enjoyed the show, you can help us reach more listeners by leaving a rating and a review, especially on Spotify or Apple Podcasts. And if your app doesn't have that option, just leave us an email or a voicemail through SpeakPipe at www.rxforsuccesspodcast.com. You can also help by becoming a Patreon member. That link is in the show notes. And we hope you'll also follow our companion podcast, Life-Changing Moments with Dr. Dale Waxman. Special thanks to our producer, Craig Clausen, our promotions manager, Mariana Rodabaugh, and to Ryan Jones, who created and performs our theme music. And remember, be sure to fill your prescription for success with my next episode.